this. Excellent, because this is part of a community. Not everyone can be here today. So this is an opportunity for those who can't make it to share it. And also it's a good reminder that we have a Slack group where you can be part of this conversation after the event. So got it. Okay. Onward. So look, it's with pleasure that I introduce our two guests today. We've got Phil Orcher, who's a proud Murawari Gumbaynir man. He's also a researcher with the Alive National Centre for Mental Health Research Translation, which is within the University of Melbourne. I'll introduce him in a moment, and then speaking will be Josh Moorhouse, who is also from the same school. They are going to have an amazing conversation where we'll have Q&A straight afterwards. So please, while they're speaking, I really welcome you to put some questions in the chat. Thanks. Over to you, Phil.
Thanks, Nick. I'd like to acknowledge country as well. I'm up on Gadigal country. Nick did mention I work for Melbourne University, and I'd like to acknowledge the Wurundjeri people that are down that way as well, where the Alive Centre is located on. And I'm from the Alive National Centre for Mental Health Translation. And before moving on, I wanted to acknowledge all the Aboriginal people who are online as well. And I'm sure you are all dialed in from different nations and all that sort of stuff, and I could see you all acknowledging country in your label. So thank you. Firstly, I want to say thanks to Emily, Sharon, and Nick for inviting Josh and I along. We're from the National Live Translational Research Centre, and we're a special initiative with 40 investigators and 15 universities and centres of research and all these types of things. And I'm not a researcher by background at all. Nick asked me earlier about my title, and the first thing I said to him, I said, I don't go by the title of researcher. I'm a Gumbaynir Murawari man, and I was raised out at Lightning Ridge, near Lightning Ridge in Garuga, and have ties to saltwater country as well up in Coffs Harbour with my Gumbaynir ties. So anybody from those regions, g'day, nice to see you, or if you can see me. And if we can go to the next slide, Buzz, please. Josh is going to be the driver as well. So I just acknowledge country as we did, but there's going to be a bit of a theme as we move forward as well at the bottom of this acknowledgement of country, and just for everybody's awareness from why we do acknowledgement of country. It's a part of my grounding in regards to my cultural protocol. And I'm sure you've seen acknowledgements done all over the place through Zoom and through pandemics and prior and all this sort of stuff. It's a part of our values systems and our processes when we're engaging with communities across different nations. Thanks, Buzz. So keep an eye out for any other slides. So this beautiful artwork as well, I just wanted to introduce that and acknowledge the brother boy Dennis Golding. Dennis is a good mate of mine. He's up here on Gadigal country, but he's also from out at Collarenebri, where country is for me as well. And we had a connection, and I've used sorry, can we go on mute there, please? We brought Dennis in again to pretty much help us design an ethos of the Translational Research Centre. And the title of this artwork is called Healing from the Ground, and it speaks to our connection as Aboriginal people to the land, and how we tread softly on it and we move forward together in a co-designed space. Thanks, Buzz. And I just wanted to introduce Josh Moorhouse, our lived experience lead as well. And I just wanted to also, before moving any further, wanted to acknowledge the lived experience of everybody in here today as well. So take it away, Buzz, and I'll be back a bit later on. And I'll chat to you soon, but keep an eye out for a few icons in the slides.
Thanks, Buzz, and thanks everyone for coming. Yes, hi everyone, my name is Josh. I'm a lived experience co-design researcher in the National Centre. My background is not research either. My background is finding ways to bring lived experience, both personally and collective lived experience skills and knowledge to the work that we do in the National Centre. And as part of that, we just kind of wanted to make a note about language just in a context for mental health reform. And so in mental health systems, those of us who have used mental health services and or who have been diagnosed with a psychiatric label are often referred to as consumers, and our family members and friends are often referred to as carers. And some people can find this language really challenging. I know I found that language challenging myself, and being referred to in these ways as challenging. But it's also important, I think, to mention that consumer movement fought for the right to be termed as consumers rather than patient, particularly just because this denotes agency. And typically in mental health systems, we don't, when using services, that we don't have a lot of agency over what happens to us in those spaces quite often. And so just around language too, some of us feel that we are harmed in mental health services and perhaps don't identify with current medical ways of understanding our experiences or identities. And so we might prefer to use the term survivor. And there's also a rapidly developing lived experience workforce in Australia, where people are being employed professionally in lived experience roles. And usually people work in either a consumer survivor role or in a carer role, but also acknowledging that there is an emergent role around consumer care and what this looks like for folks too. And just in this context as well, whilst it may be true that many people are in professional roles and also have lived experience, and acknowledging the many different experiences that we hold, being in a professional role with lived experience of a particular diagnosis or using services, we don't see this as the same as being in a lived experience role, because this is about sort of creating designated spaces to hold a particular perspective and worldview and to embed that within our contexts. And this lived experience work can be really hard. It's not for everyone, but it does require us to build on what has come before us. But in saying all of that, we just, when we're working in this context in mental health reform, we like to recognize this lived experience. And so we'd like to recognize all of the collective lived and living experiences in the room today, and celebrate just any diverse ways of thinking, being, and doing. And we just want to recognize that mental health reform is deeply personal work. And we recognize the unseen emotional labor that is required of consumers and survivors and care professionals and of all of us working towards this. So we just want to thank everyone for sharing the space with us today. And so just moving on, just a little bit about the National Centre. Just got a little bit emotional as I was saying that. I guess that's sort of the theme of this being emotional work. But as a National Centre, our model for operationalising our networks is through what you'd see here as 4 national networks. And so they are an alive research collective which aims to build capability and strengthen lived experience-led research and implementation. And for implementation and translation, a national network of mental health service delivery partners across primary care and community settings. We also have a co-design living labs that has a vibrant membership of over 2,000 people with lived experience who come together in various ways, in various moments, to co-design in an end-to-end research translation model. And also a next generation researcher network for research higher degrees, early, mid-career and clinician researchers. And so the Alive National Theory for Ecosystem Change that's pictured here helps us to understand our vision and mission through 6 focus areas that are pictured there on the left around prevention across the life course, longer, healthier lives, priority populations, lived experience, capacity building and mental health care at scale. And we see that these focus areas and work that's associated with them could contribute to our vision of vibrant communities that support mental health and promote well-being and enable people to thrive, and our mission of transforming mental health and well-being through primary care and community action. And we acknowledge that making sense of ecosystems requires us to think about what activities are being undertaken that relate to all of these focus areas and our mission and our vision. And as part of that is us understanding that mental health systems are not something that can be simply fixed. We're seeking to learn about these systems and create ways to respond to them. And in doing that, that's not simple either. There's no one size fits all approach to doing this and to transforming these systems, because there's just so many parts, and that all of those parts are connected to other parts, and those parts are dependent on each other. And so we're trying to understand what parts can we address, and what do we have the capability to create change in. And so we say that we need collective approaches that support our teams, organizations, networks, communities, and other social movements to collectively change the environments in which we learn about and respond to mental health systems, and that help us to challenge the current status quo and move towards more desirable futures. And so this is sort of how I'm thinking about all of that, kind of from, you know, what I know from a disability justice lens, I would probably name this, and moving from a sort of a deficit model of our experiences towards more social model. So commonly, the status quo is to see our ways of being from a deficit perspective. And so this might also be commonly described as the medical model of disability or the biomedical model of illness or distress. And so deficit models see problems as existing in patients that need fixing and often frame us as the problem. And social models understand that people have barriers which need addressing. And some of those barriers might manifest in ways where, of different ways of being, and those different ways of being need to be accommodated too. And so some examples of social models which might be more preferred might be, you know, a neurodiversity way of thinking, or even a mad pride perspective on our experiences. And so moving towards the top right, if we're thinking from a perspective of social determinants of health, what we're saying is that things like housing, trauma, family violence, etc., intergenerational histories, these are often what contribute to these barriers, but also to the resources that people may have access to as well. And so how we're understanding that all in the context of social innovation is that you might see that social innovation occurs when teams, organizations, networks, communities, and government focus their attention towards these social determinants. And that perhaps systemic innovation then occurs when attention is focused on building relationships with other communities with an intention to learn from one another and move towards a more desired future. That's in that middle square there. And then below that is just how we're thinking about scaling impact towards a more desired future. That might occur when the variety of barriers and determinants are met with an equal variety of community responses. And then alongside all of this, I'm sort of holding, you know, what does this look like in terms of applying a worldview from lived experience? And so how I'm understanding this is that perhaps applied lived experiences practices then might therefore seek to change the current way of doing systemic social innovation, in fact, and change the current ways of scaling impact. And one way to do that that helps us work with different worldviews is co-design. And so I'm sort of thinking, I guess, about what is co-design in 2022. And this visual is influenced by, you know, my work with the Alive Centre, but also I've done quite a bit of work with, you know, the Australian Centre for Social Innovation. I noticed there's a few folks in the room from there as well today. So just acknowledging that has sort of helped the way that I think about co-design as well. And so, you know, I'm sort of making sense of co-design as being a mixture between good practice co and good practice design. And so when I'm thinking about good practice co, we're wanting to create the conditions, you know, for lived experience to work with social movements, with diverse worldviews, with a spirit of, you know, building on human rights principles and with equity, for decisions to be made by and with those who are most impacted by the particular issue that we're addressing. And when we're thinking about good practice design, we're thinking about using rigorous innovation methods to produce new things like policies and services and products, or perhaps even new ways of working in entirely new communities and things like that too. So just acknowledging that. And then so beyond co-design and just thinking how we might want to start moving in the direction of participatory ecosystems and how we might build the conditions for that. We establish conditions for consumer leadership and mob leadership of ways to gather, organize, and respond to information about translative mental health ecosystems and using digital technology such as the Wicked Lab's online tool for systemic change. And also through the Wicked Lab Complex Systems Leadership Program, that was about us strengthening our understanding of systemic innovation. So we had something in the middle that we could have a discussion about and understand how we might apply our different worldviews. And also then just sharing current progress through picture guides and regular updates and things like this. And so moving on from that and how we might work together, this visual above here was inspired by the Power Threat Meaning Framework, which was co-created with consumer leaders alongside Dr. Lucy Johnson and Professor Mary Boyle in the UK as an alternative to psychiatric diagnosis. But it just, this part of it really helps us just to think about how power is operating as a resource in our different environments, and recognizing that not everyone always has access to all of these resources, and that there might be times we need to step in and out of power, and we might use this part of the power threat meaning framework for when we're setting out to learn about and respond to mental health systems, through supporting each other to recognize what our strengths are, through establishing shared rituals, or connecting to nature and knowledge, and celebrating our special interests, or building upon the pride of our own identities and neurodivergences, madness and spirituality and cultures, and any other ways of being that feel important to celebrate and to bring to the fore. And we should just consider if these things are easily accessible to us and others in our environment, and then seek to make what is available to us more accessible to those who may require it. And so when trying to understand what to learn about or what to create change, folks should look in places that we, from lived experience, say are important to us. And so this visual shows what people with living experience identified as being important for co-producing new information about health systems. And it was also synthesized by a lived experience researcher, which is just to demonstrate multiple ways in which lived experience knowledge and skills might be embedded in learning about and responding to mental health ecosystems. And I just wanted to sort of point out just some insights, on here that just felt important to share, just at the bottom right, as well, just around, we should always, from the outset, seek to begin with a lived experience formulation of a situation. Often when we don't do that, we find that we don't, that we maybe have gaps in how we understand a particular situation, or we just, with our own internal worldview. And so it's about how do we create ways and processes where we can begin with a lived experience formulation of a situation. And then in doing that, we should look for directions from lived experience guides. And across all of this, looking across everything that we do, we should always be seeking to activate, anti-racist ways of working as well, and be really intentional in how we do that, I think. And so this co-designed pocket roadmap shows how the National Centre is prioritising national implementation efforts around what is important to consumers in care and consumer care lived experience, showing 3 areas. And so the first area is on the left, is around research priorities. And so what was identified as being important were lived experience across all areas of research, for professionals to be better educated, prevention of mental health issues in schools, rural and remote mental health and legal rights, and around mental health care improvements. We want suicide prevention efforts. We want to build upon the lived experience workforce, non-pharmacological options and treatments with less side effects, psychosocial care to focus on, alcohol and other drugs, and optimize medications. And then when we're thinking about social determinants and what we feel really strongly about trauma, accessibility, family violence, stigma, and housing. And what we're saying and how this was conducted, this is not, the result of, say, my work or Phil's work directly. This was a collective effort, a co-design effort of the National Centre. And so this used an emotions mapping technique, where 88 people emotion mapped using an online co-design board. And so what this was about is, undertaking work that already existed within a lived experience team that we partnered with to identify mental health research priorities from lived experience, and then asking people with that lived experience what we actually feel strongly about, rather than sort of ranking. It was about what we felt strongly about. But also, as you can see at the bottom there, we also have an Aboriginal and Torres Strait Islander pathway, and we don't yet have mob priorities to guide us with this, as Phil is about to embark upon a national co-design effort to identify those mob priorities to guide us. And later in this presentation, he'll be discussing how he's been working to embed a mob way of responding to complexity in preparation for that. And then when we're coming together to think about what we might learn about, we should ask each other then what priority we could learn about or respond to. and who would be the most appropriate to guide this, and if we need to recruit for this guidance. And then we can set some sort of intentional time constraints around how long we might actually sort of learn about that, or about, you know, who's addressing those different priority areas and things like that. And when we want to share our learning, we visualize our learning through just some simple picture guides. And so when we're building on the network mapping feature in the Wikidlab tool, we understand that activity is represented as a line, and different roles and partners that are working on that different activity, we represent that as a node. And what's showing here as well, just around those different action areas, is just showing that for some work and some activity, it will be lived experience led, and some activity will be mod led, but we also hope to find, you know, mutual activity as well, and where we may have shared priorities and things like that too. And sitting around that, we also need to develop shared guides for understanding our different action areas, you know, and we might understand an action area as, say, you know, different types of innovation. And so we're thinking about these priorities, we're thinking about our focus areas for ecosystems change, and then maybe we want to know, you know, what policies, what services, what networks, what products, what programs, what processes, and having a shared guide for what those things mean to us is really helpful, because then we can have a shared way of collecting information about those things. And so then we want to understand, where are we undertaking our learning, and then also where are we creating a response. And so when gathering, organizing, or distributing information, we want to establish what environment that is that we're working in, or where we might respond to. And so how we're thinking about that is just with, you know, there are teams within our organizational ecosystem connecting to those national networks and then to the broader community. There will always be things that sit outside that might be also addressing mutual priorities, and also how do we work alongside government to thinking about the Wikidlab framework. And so sometimes I think it's just about having a good spreadsheet template, you know, for us to collect information in. And I think that's where, you know, also where it's been really helpful working alongside Wikidlab, and just, you know, it's being supported by Wikidlab in this template. And so we want to gather and organize this information about different activities which are targeting the different action areas and different priorities and so on. And so, you know, what's been shown here is just, you know, we might identify the activity, you know, and that would be represented as a line, you know, the different information about that. When did it start and when did it finish? What's the kind of primary contact information? And then what are each of the roles and each of the partnerships that exist on each activity, and what action areas are they addressing? And then we can use this information to generate things like network maps that capture roles, activities, and action areas, and action profiles, and things like activity timelines too. And so this is an example of a learning loop, what we might call a learning loop, where two lived experience researchers undertook some learning to gather information about a project undertaken by a partner within the Alive Implementation and Translation Network, and together looked at what activities could be found when exploring different types of innovation, and which key roles could be found partnering on these different activities. So as you can see, you know, in these different action areas of policy, process, and services, and models and things, there were kind of different types of roles on these as well. And in terms of processes that we found in that learning loop, you know, we found different processes too, around consultation, engagement, co-design, and co-evaluation, and things like that, and just acknowledging that those are different processes as well. And so in that, using that same framing around types of innovation, then we might be able to visualize what activity is being undertaken within a lived experience team that is mapping out these different action areas. And so what this is showing here, again, like with the nodes representing the different roles, and the lines representing the different types of activity. So what we have is, you know, lived experience co-design researcher, a lived experience co-lead of the co-design living labs network. We have a co-directorship model within the National Centre as well. So the two co-directors, and one being a lived experience co-director. Also a co-design researcher working from a mob perspective, and also partnerships within our collective as well. For example, how we're partnering with Wikidlab. And so if we look at 1A, that's showing our different activities And so what we have is lived experience co-design researcher, mob, and co-director working on an ecosystem protocol. So how we go about doing this work. And so what that's showing is the different worldviews, and also that we're working, within, alongside, executive researchers in our context as well, just so that we are building those conditions for when we can and can't make decisions about certain things too. And when we are thinking about applying digital technology, that's being shown through 2A here. So we've got co-design researcher, mob co-designer, and the collective partnership working on the Wicked Lab tool for systemic change and how we're applying that. And then when we're thinking about these learning loops, we've undertaken some lived experience leadership and peer learning, some physical health learning, prevention learning, implementation and translation network learning. That's what I was mentioning before in the learning loops. And that's been undertaken between the lived experience researchers. So just demonstrating who's working on what, and what types of activity are being undertaken. And then when we've gone and presented that to different streams within our networks too, so around prevention and populations too. And so what we're saying is, in thinking of all of that, I suppose it's important to say, this is a guiding framework for how we're doing that. We can, no one of us can do every single step along the way at every time, but when we're setting out to create system change, some things that feel important to share is just saying that, when we start, we should think about what issue could we learn about, what question could we respond to, and then who is most impacted by that issue or has lived expertise of that question we want to answer. Then how might we make decisions with those people, and can we recognize our own power and our own resources, and how can we maybe build from lived expertise to build from what already exists. And so when we're recruiting and when we're working with different worldviews, sometimes that's about embedding a lived experience alternative, an alternative that has been designed from a worldview of lived experience. Sometimes that's about embedding co-design principles and philosophies, so what's been created through co-design. Sometimes that's also about recruiting mob guys to embed mob ways of working. And so that's what Phil's going to come in and speak to now, is how he's been embedding a mob way across ways of responding to complexity. So thanks everyone, and thanks Braz. Take it away.
Thanks, Braz. As you can see, everybody, lots of learning has happened over the last, I think it's been about a year since we connected with Emily and Sharon. And along the way, we came with a massive problem, and we didn't know where to start at the beginning. And we had some great guidance from Sharon and Emily in regards to where do we start off from, so that just before these slides all start coming together, my role is the co-design lead for mob, for Aboriginal and Torres Strait Islander people in the priorities population stream that was shown a little bit earlier. And as you can see, Aboriginal people aren't homogenous. They're the nations right across the continent. And for us, we had to set up a boundary first. And that boundary was our nation, which was fantastic. But we were talking about Aboriginal people, different mobs from different countries, different cultures, different everything. You can literally throw a stick and be in another person's country. So you have to make sure that you tread lightly. Going back to that co-design, the image behind me around treading lightly when you're on country with community and all that type of stuff. So these wonderful little icons that you've been seeing right throughout the presentation of Josh's, with all of his great artwork as well, and it speaks a lot to how I've approached using the Wicked Lab tool. When I jumped into the workshop with Sharon and Emily, I felt this connectedness to it. I really did, and I had to sit down and listen to it and take it all in. And I've seen a couple of other what we call ourselves students of the Wicked Lab tool, right? But I've seen a couple of other project teams that were there that day, them couple of weeks. And I was probably the quietest one there in the class, and I was literally trying to be a sponge and soak up as much as I could. But the problem is that I couldn't let go of who I am, my identity as an Aboriginal person, my Gumbaynggirr background, my Moorhouse background as well. So I came with a worldview. And if we can go to the next slide, please, Buzz. That worldview was guided by a pedagogy that was developed with mob from Western New South Wales. Western New South Wales is where Garuga is, the Moorhouse side of me. And I was raised on country up there, community of 280 people. So those values and all those types of things these types of things were embedded into me inadvertently along the way, you know, getting flogged by Nan and all these types of things when I stepped out of line. But it was teaching me a lesson about respect and process and protocol and all these types of things. I saw in the chat a feature a little bit earlier saying that you couldn't really see the writing, but I'll give you a bit of insight to it. So I'll start from the top right, which is that circly symbol there, and that's your community links within community. That's making sure that you set your boundary, you know who your key contacts are, who your links are in the community. So if you put that into perspective as an engagement approach, you're talking about stakeholders and all those types of things. Before you go into community, you need to, once you connect with community, you can get on country and you can start deconstructing and see what that actually looks like, how it would work in community. And then you go down a little bit further, but you're not going to have a straight yarn with community. It's going to be bringing in a whole lot of other issues and all those types of things a part of the problem, because co-design isn't coming in there with the solution. That's my approach moving forward the whole way along, international approach. So we're making sure that we're going there with an open mind and an open heart to understand that our yarns are going to be non-linear, but we're going to be reconstructing it along the way. And those land links, where are those communities most affected by these themes that were in that roadmap that Josh highlighted before around the priorities? So we go to those communities and then we talk about them. And then we have a yarn about, are these priorities aligned with what the community needs? And if not, we'll go up to the top there where the land links learning maps is, and it looks like a snake, but it's us drawing pictures and breaking it down as a journey map and trying to figure out how do we get to a solution together, what needs to be involved along the way. And that whole way through the non-verbal side of things, making sure that we sit and listen. Some of my teammates in the Wicked Lab school saw me just sit and listen and just taking it all in. And Josh shared a story with you about how the Life Centre is going to achieve all these priorities over the next 5 years. And then how do we adapt all of our resources moving forward? And then using symbols and images. You see it now. You see it in all of your organisations around your RAP plans, any marketing material aimed at Aboriginal people. Artists are designing and interpreting content for organisations. So that's how I've lived my whole life, all the time. Next slide, please, Buzz. But they're underpinned by those values, those systems, those processes, and the protocol. So you saw the multiple nations, the diversity of nations that I have to go into. And I've got to make sure that these protocols, these values are always aligned with the communities that I'm going into. This worldview is a Western New South Wales worldview, designed by Dr. Tyson Younger-Porter, author of The Sand Talk. It's a wonderful book. So have a check it out and he'll give me a plug. I'll get a plug for him. Hopefully get a new copy soon. Next slide, please, Buzz. Now, the Wicked Lab tool I mentioned earlier, it was very familiar to me because it had the combination of everything in that 8 ways of learning there, the complexity, but the simplicity, but the complexity. Couldn't really have one without the other, but they've broken it down for us in regards to the focus areas within the tool, if you're familiar with the tool just yet. So these focus areas are the 9 focus areas, but they're broken down to 36 characteristics of a wicked problem. Wicked problems were new to me, but very familiar because of we're very familiar with the KPIs of government, with the closing the gap reports and all those types of things. You need to fix one thing, you need to fix another thing. If you don't fix another, the other, you're going to fall down. So that was like, oh, okay, light bulb moment. And then I had to bring my worldview again. My worldview came along with me again. And then next slide, please, Buzz. I basically applied my 8 ways of learning, my land links, my stories and symbols and images and all these types of things all the way along the process. In the Wicked Lab tool has definitions of what each focus area is and what support you can, what sort of guidance you can do within each phase. And this is just another way of when you're working with mob, how you can engage with community on the ground, remove any barriers. And then the ecosystem or the eco mapping tool creates this wonderful visual, because yeah, I'm a visual person. I got HD TV, 720p, love it. But it also a wonderful tool for community members to understand where their barriers are, where the opportunities are, that as they reframe it in the tool, where you can make sure that you can say, well, John Smith is in control of this funding over here, and you need to speak to this bloke over here, because that's going to address the solution. And next slide, please, bud. So basically what I've done is just put the focus area to the bottom, and then I've just brought my culture to the top and led the way the whole way through. Thanks for that little tip, Emily. I think it's flowed really well. And what we're doing moving forward is incorporating other world views along the way as well. So that way that our connectivity with culture across the nation, because I spoke about with Emily just before we got on around how communities before Wi-Fi existed and colonization and all these types of things happened, there was all these values that were underpinning our travels and our trade and all these types of things and how we did things. Very complex, yet very simple, and always grounded in protocol and process. So that's what's going to be leading our way moving forward into designing our roadmap with Bob and asking what those priorities are. And I've been empowered with the knowledge of what a wicked problem is, because it's translated what a closing the gap report type thing is, and how governments approach Aboriginal issues as well. And then going back to community and breaking that down to community so that they can understand as well about how they can remove any barriers. And yeah, I think that's my last slide, Buzz. Oh, no, it's not, sorry. So how we're going to localize each content is making sure that we achieve these vibrant communities with support that support mental health and promote well-being and enable people to thrive in those communities. First things first is what I did when I got to the Alive Centre, was change the language on how we speak about mental health in community, because community don't speak about mental health as a clinical approach. It's a holistic approach that we have, that our Aboriginal community controlled sectors address our social and emotional well-being. So connectivity with land, culture, people, community, all these types of things are the things that are needed to contribute for quality of life with community on the ground. And along the way, I'm sure you saw in that map that community and land are at the forefront of anybody's need, rather than KPIs for organisations. So this particular piece here is a part of the artwork that Dennis had created for me, and we're going over to Western Australia, because it's all on the western side of the continent there. But we're going to have co-design yarns, gatherings, having people come together, talk about the issues, and have things rise to the surface, and reciprocate everybody that comes along, protect their data as they go along as well, around data sovereignty, because we're making sure that ownership is of the communities as well, because all of these social and emotional well-being frameworks and tools are localized, and we're just bringing to the surface best practice across the nation for clinical networks to understand that social and emotional well-being doesn't have to be stuck in the clinical space, but also it can be addressed on country as well for the well-being of mob. And that's where I think is the last slide for me, bros. It sure is. And thank you, everybody. It was exciting. I've been waiting to come along and have a yarn with everybody, and Josh and I have been preparing for a couple of days now, so I hope you enjoyed it.
Thanks, Phil. And everyone just join us in a round of applause for Phil and Josh. That was a fascinating presentation, I'm sure. We don't have comments in the chat, but please feel free to put some in now. We'll just have a few minutes for some questions in a bigger room before we maybe break into smaller conversations. But I might just start with a question. And Phil, you spoke to this, but Josh, please also contribute. Where has this, you talk about how the first step was introducing you to the idea of wicked problems, as part of your partnership with Wicked Lab. But how has the tool sort of created, I suppose, where has the tool helped you to really tackle some gaps in your thinking or gaps in your sort of strategy? Where did it really help you accelerate, your work?
The gaps for myself was the communication to my peers about how I needed to engage with people. The wonderful thing about the tool, I mentioned it in our catch up before, Nick and Emily, that I felt it was really culturally coded. It was location wise, it had individual wise, it had the land links, all those types of things. And then it even spat out a visual for me. So symbols and images was right there in front of it as well. So, and then you can interact with it, you can move around, and yeah, it moves and orbs and all that sort of stuff. So bringing a visual along with the data, backing it up, and along with the heart of my background, with my lived experience as a blackfellow, to showcase these are where the opportunities lay. I can go speak to Heather. Heather, I just saw your chat in the you're speaking in the chat. Well, I can go to WA and I can speak to Heather because she needs to speak to the Wicked Lab tool, just as an example. We'll have to have a chat later, Heather. Just answering your question.
Thanks, Phil. And how about you, Josh? How has, I suppose, the tool shown that sort of neutrality, but, great strength in reaching or translating your work?
Thanks, Nick. Yeah, I think, we were having a yarn about this, but I was like, even over the last couple of days, as we were trying to think about how we present this and things like that. And when we first came into the centre, we are a national centre that exists to translate mental health at scale in ways that are led by, consumer survivor lived experience, but also to do that in a context where we're really, we're really working with mob and mob ways of working and mob priorities too. And so I think, in the beginning, when Phil and I are coming together, it's sort of how do we work together and have those yarns, where we can both hold our different worldviews, in ways that we can understand mutuality in those worldviews, but also understand where there's difference too, and to honor that. And I think that at least for me, what the Wicked Lab tool did was, in these 36 ways of working, they were sort of almost like an interface, like in the middle of those two things, where we could actually say, okay, here's these 36 ways. What do you think about that? And what do I think about that? And I think where we're at with that is it's actually just kind of becoming a tool that we can have some yarns together about those things. And that's actually just a really ongoing learning journey. I still have so much to learn, in doing that too. But if you think of some examples, in those 36 ways, it's just things like, how do you manage your starting conditions, or how do you surface conflict, or how do you create controversy? It's like, okay, well, how does mob do that in mob ways, or what's a mob way of doing that, or what's a way that's really important when, for me, from a survivor perspective, it's like, if I think about surfacing conflict, it's like, oh my goodness, like there's so much in my own history around, family violence and things like that, and being able to be trauma responsive and things like that, so there's things that I've got to really consider and be able to bring to the fore, in that too. And so just trying to understand, what does that mean, when we look at these things and have these conversations. And I'd say that that's really just an ongoing conversation at the moment, I think, in terms of.
Could I just add to that too, Nick? I think it's a great, Josh mentioned it before around a yarning tool, and you think of the people that are going to be at that table when you got CEOs there looking at data in front of them that are data driven the whole time, when they're moving forward trying to achieve KPIs for the community and all that sort of stuff. When it doesn't align with the community's need and the KPIs is something else that they want to achieve, how are they going to be persuaded to sit down and reevaluate what the priorities are with community?
Yeah, fantastic. Look, I'm just looking at time. Emily, I think we'll just shorten those breakout rooms a little bit, because I think what we want to do is give people an opportunity to share some of their reflections on this. In particular, I think the question we have for you is, what is the worldview that you bring to your systems thinking? Because what we have here is some great perspectives from Phil and Josh, which is sort of their story. But each of you have a story and a potential opportunity in terms of bringing systems thinking into your work. And this tool is a great way to accelerate that. So we're going to put you in breakout rooms. I think we've got maybe 8 minutes. And so please accept one of those invitations. We'll broadcast the question in case you missed it. But we'll see you in about 8 minutes and we'll share some of that discussion. Well done, Josh.
Thank you. Cheers.
Emily, do you want to pause the recording? I think Tamara and Amy are back.
They asked you to consider
That
the
was pretty
obvious
abrupt.
minimum
Apologies for that. Mid-sentence. I hope you had great opportunities to connect on the topic, and it's good to see some other new faces in the audience. We only have a minute left, so we do not have the opportunity to share as hoped. But if you can put something in the chat, maybe an aha moment or something that was really powerful from today, please share that in the chat, the 1 minute we've got left. In the meantime, perhaps now crowded out by that idea that I just threw out there, Emily, is Emily's going to put up some links, and they're links to the Alive Centre, but also to Wicked Lab. You're already probably got a link to the Slack group that we have as part of the community of practice, but please continue the conversation there. We love to turn this theory into practice. We love to tackle complex problems with complex solutions, and we need to do that collectively, not individually. So thank you for being part of this conversation today. Join me in a round of applause for Josh and Phil, who have just been so fascinating and a great inspiration in terms of what we can do with this way of thinking. So thanks for joining us. Love to you all. I'll see you again next time.
Thank you, everyone.
Thank you.
Thanks.
Ciao, ciao. Brilliant.